Hi, and welcome back to my channel. Today we're going to talk about medications and prescription drugs that may be accelerating the spread of the COVID virus. This may be the missing link in explaining all of the deaths. People supposedly are okay, they seem to be fine, they get infected and they die. Why? And then other people get infected, test positive, they're asymptomatic, they just have to quarantine for a week, they have mild symptoms, and they're fine. And the random way the virus infects and kills. So there's something behind the scenes here that maybe nobody is looking at right now. Now let's look at the United States death statistics for 2019. So that year, 2,855,000 people died per the CDC in the U.S. in 2019, and out of a population of 328 million, that's one person in 115 will die each year in the U.S., roughly, COVID or no COVID. And this is an average of 7,800 people a day will die in the U.S. So when you say that COVID, there's 2,000 people who died, that's fine. There were 5,000 other people who died the same day for other causes. And here are the U.S. leading causes of death in 2018. So you can see heart disease, cancer, in the numbers here of 647 heart disease, cancer, 600,000, lower respiratory, 160, etc., etc. So people are dying every year, and these are the death rates. So heart disease and cancer are going to beat the COVID deaths. So basically, if we look at the death rates, with COVID, a person has heart disease or cancer, they get COVID and die, they simply move over to the COVID death column. So the numbers will be shifting around, but there's still going to be deaths every day and every year. And COVID is just accelerating the death rate. So medications that weaken your immune system and fungal infections. So people with certain health conditions may need to take medications with side effects that can weaken their immune systems and put them at risk for fungal infections. So there are many side effects to prescription medications, and they may affect people differently. Some people will have different reactions. So again, if a person gets COVID and they're on medications, there could be an adverse effect. So we'll see what happens. And how drug abuse, alcohol abuse can weaken or suppress the immune system. And this can lead to considerable damage to many systems in the body, especially the immune system. So nearly 1 in 2 Americans takes prescription drugs, and I would imagine it's similar in other countries proportionately. So it's about 46%. So you can see here the therapeutic drug use. So at least one prescription drug in the past 30 days in the U.S., it's 46%. 3 or more could be 20%, and 5 or more, 5, 6, 7, 8, or 9 prescription drugs, it's 10%. 30 million people in the U.S. are taking more than 5 prescription drugs, 5 or more prescription drugs in the last 30 days. So the cause of COVID deaths are pre-existing conditions. The virus might simply accelerate their condition and finish them off. Diabetes, obesity, high blood pressure, these are all mentioned. Drugs and alcohol abuse. Certain age groups, seniors, are more at risk if immune system is compromised. You have medications that interfere with the immune system, and this is the thing that we're talking about here. Medications that interfere with the immune system, which could open the door to COVID and possibly death. You have bad nutrition or various deficiencies in terms of vitamins or minerals. So you have smokers and lifestyle risks, bad luck, etc. So there's always somebody at risk, and everybody will react differently to either disease or medications. So if you're not in one of the categories mentioned here, you may have a better chance of having an accident and getting or dying of COVID. And on average, it is the pre-sick are the ones dying of COVID and not the healthy. So a person could appear healthy, but they seem normal, but they're on 3 medications. They are part of the pre-existing conditions. So our bodies are the daily battleground with viruses. And our bodies are a perfect machine, and they will protect us. So they will develop immunity to the daily onslaught of viruses and germs, and they've been doing that for millions of years. So their ability to protect us is there, but we have to make sure that we take care of our immune systems and give them the nutrition that they need so that they can help protect us. So it may not be about disinfecting everything. It might be more about strengthening the immune system and things we can personally control, such as our health and nutrition, health education, taking personal responsibility for ourselves and our own health, vitamin D and other supplements. We're not really talking about this much. It's like it's just all about vaccines and, disinfecting everything. So we have to look at these things basically in a new light. And in conclusion, more discussions of the role of medications in the spreading of COVID or weakening the immune system. Possible explanations of the mysterious and unpredictable nature of the virus could be explained by all these medications. Again, a person seems fine, they look fine, they appear to be fine, but they're on medications, which means there's a pre-existing condition there. That's 30 million people in the U.S. who are taking 5 or more medications, and 46% are taking 1 or more medications for all sorts of pre-existing conditions. So there's a lot of pre-existing conditions out there. So this could be the possible reason for increased infection rates, and we have to look at the role of nutrition and vitamin supplements in the fight against the virus, and not just, we're going to wait for the vaccine. So maybe all the lockdowns and economic havoc could have been avoided or lessened if we would have taken some of these precautions or talked about these things earlier on. So we shall see. So thank you very much. Hopefully you enjoyed the video and it gave you some more perspective on what's going on. So hopefully you enjoyed it. So please hit the like button and subscribe to my channel. And I will see you next time.